Today we will learn retinaculum. Retinaculum. It is derived from the word retinere. Retinere, a Latin word, means to retain. It is the modification of the deep fossa in order to retain the tendon. Either it can be extensor tendon or flexor tendon when it passes across a joint, on the flexor aspect, on the extensor aspect, anywhere, in order to keep the tendon in arranged way. And the second is its purpose is to for the insulation of that tendon. Okay, and third is to prevent the buckling, bowstring or buckling of the tendon during the movement of the joint. There are three functions. Now, what about the what are the types of retinaculum? Retinaculum. It may be of wrist joint. It may be of ankle joint. It may be of knee joint. Okay. At the wrist joint, there is flexor retinaculum on flexor aspect. There is extensor retinaculum on the ankle. There is again flexor retinaculum, extensor retinaculum, as well as the peroneal retinaculum. And the knee joint, there is medial patellar retinaculum and the lateral patellar retinaculum. These are the variety of retinaculums. They are giving way to the tendons. About the histology, this retinaculum, I have said it that it is a modification of the deep fossa. It is made up of three layers: superficial, middle, and the deeper layer. The deeper layer is shows the chondroid metaplasia. Chondroid metaplasia. It looks like cartilage. Looks like, not the cartilage. Looks like. It shows chondroid metaplasia and contain hyaluronic acid secreting cell. These are gliding in nature. Gliding in nature. The middle one is thick. It contains fake, that is the fibroblast, elastin and the collagen fiber. Superficial one, it is made up of loose connective tissue. Loose connective tissue and contain vascular channel. Okay. About the surgical, I can say clinical correlation, this retinaculum is used for the repair of annular fibrous flexor sheath. We all know that the fibrous flexor sheath is the modification of the deep fossa, one of the modification of the deep fossa in the palmar aspect of the hand. There are three modification of deep fossa in the palmar aspect, that is the palmar epineuritis and the transverse carpal ligament and the fibrous flexor sheath. And fibrous flexor sheath, there are two type of arches are there, that is the annular and the cruciform. A1, A2, A3, A4, A5 and C1, C2, C3, and in the thumb A1, A2 and only C, which lies obliquely. So if the annular A1 to A5, anyone, it get injured, then it can be replaced by this retinaculum. Okay. Now coming to the flexor retinaculum of the wrist. This is a postage stamp like. Suppose This is the thumb, and this is the little finger, and this is postage stamp like, and it has got a superficial lamina and the deep lamina. That's why I am showing it in a broken with the broken line. It is attached. She looks too pretty. She looks too pretty. That is scaphoid. Try to catch her. That is, here is the trapezium, and here is pisiform as the hook of Hammett. So on the lateral aspect, it is attached to the scaphoid, the tuberculus of a scaphoid, and the crest of trapezium. The crest of trapezium has got two ridges, that is the lateral and the medial. The upper one, that is the upper lamina, is attached to the lateral, and the deep lamina is attached to the medial margin of the crest. Okay, and on the ulnar side, it is attached above with the pisiform bone, and the below it is attached to the hook of Hammett. And few superficial lamina arises from here, and then again insert over the flexor retinaculum to form a canal that is known as the Guyon's canal, and it gives passes to the ulnar nerve and artery. Okay, this flexor retinaculum from above the palmar cutaneous branch of the median and ulnar nerve passes, and below with all this attachment and all the carpal bones, it forms the carpal tunnel, which give passes to the ulnar bursa containing the fourth tendon of flexor retinaculum superficialis and fourth tendon of flexor retinaculum profundus, and the radial bursa containing the tendon of flexor pollicis longus, and this lamina, the deeper lamina, from here the flexor carpi radialis passes from this space. Okay, only up to the first metacarpal, and this space is it gives way to the look like three, that fourth tendon of flexor retinaculum superficialis and fourth tendon of flexor retinaculum profundus enclosed within the ulnar bursa, and this is our radial bursa containing the flexor pollicis longus, and from here flexor carpi radialis passes, and with the Guyon's canal the ulnar nerve and ulnar artery passes, and above the flexor retinaculum, this is the tendon of the palmaris longus, which convert here to form the palmar epineurosis, and also there is flexor carpi ulnaris passes just intermingle with that flexor carpi ulnaris here, and intermingle with the proximal part of the fifth metacarpal bone. Okay, so this is about the flexor retinaculum, and about the extensor retinaculum. About the extensor retinaculum, suppose this is the, I have said about the flexor retinaculum. Now extensor retinaculum is on the back posterior aspect of the, when we keep the hand in the anatomical position, on the extensor aspect on the back of the hand, at the level of the wrist joint, there is an oblique like this. कोई भी चीज़ जाना चाहिए तो हाथ में जाना चाहिए ना, तो as if the hand will be like this, so the course will be in the back, so that it can reach palm. Just to memorize it, that laterally towards the radial side it is above, and ulnar side it is below. So here is the radius, so it is attached over the lateral margin of the radius, and the medially it is continuous with the medial margin of the palmar epineurosis. Okay, medial margin of the palmar epineurosis. So this is the extensor retinaculum. It contains the 6 channels, give way to the six compartment, and from lateral to medial This is first, second, third, fourth, fifth, sixth. In the first compartment, there is abductor pollicis longus and extensor pollicis brevis, the anterior boundary of the anatomical sternum box. In the second, there are two brothers, that is the extensor carpi radialis longus and extensor carpi radialis brevis. In the third, posterior boundary maker, that is the extensor pollicis longus. The fourth, we have to show ID, that is the extensor indicis and extensor digitorum. From the fifth, there is the extensor digiti minimi, and from the sixth, extensor carpi ulnaris. Okay, now coming to what next, that is the flexor retinaculum of the ankle joint. So this is the ankle, this is the flexor retinaculum. So in respect of the foot, this is the extensor aspect and this is the flexor aspect. So in the back side, so I have to show in the dotted line. So flexor retinaculum, it is medially it is attached to the medial epicondyle, medial malleolus, and laterally it is attached to the suppose this is the right foot, so medial malleolus, and the laterally it is going up to the lateral margin of the lateral surface of the calcaneum. This is calcaneum heel bone. So this is our flexor retinaculum. Flexor retinaculum, and the doctors are not hunters. So from medial to lateral, the doctors, that is the tibialis posterior doctors, that is the flexor digitorum longus, are not, and that is the artery and nerve. So tibialis posterior artery, posterior tibial artery, and the nerve is the posterior tibial nerve, posterior tibial nerve. Okay, and the doctors are not hunters. And at last, flexor hallucis longus. This is the arrangement. Okay, now coming to the extensor retinaculum of the ankle joint. Extensor retinaculum, that is on the anterior aspect. Okay, and this is our extensor retinaculum, and it is like Y-shaped. This is Y-shaped, and there is inferior stem and the superior stem like this. So laterally it is attached to the lateral surface of the calcaneum, and really there is, what is the arrangement of the tendon? The Himalayas are not dry places, that is the tibialis anterior, then extensor hallucis longus. The Himalayas are not anterior tibial nerve, not deep peroneal nerve, are not hunters, that is the extensor hallucis. The Himalayas are not dry, that is the extensor digitorum longus and peroneus tertius. Okay, so here it is on the lateral aspect, it is attached to the lateral surface of the calcaneum, and then it give rise to two lamina. Suppose this is the lateral surface of the calcaneum, and then this Y and the stem of Y convert into the superficial lamina and the deeper. This is deeper lamina and this is the superficial lamina, and it encloses two muscles, that is the peroneus tertius and the extensor digitorum longus. Always remember, the bifurcating limb is towards the medial side. Okay, so and this is the superficial lamina and the deeper lamina. Now they are uniting. They are uniting with each other, and beneath which the anterior tibial nerve and the deep peroneal nerve. Anterior tibial artery and deep peroneal nerve passes beneath which, and then extensor hallucis, then it is going superiorly and the inferiorly it is continuous with the plantar aponeurosis, and superiorly it is continuous with the medial malleolus here. Okay, and again above it is enclosing here the tibialis anterior by making superficial lamina and the deeper lamina, but here tibialis anterior passes beneath. Okay, extensor hallucis longus, here extensor hallucis longus beneath by only one lamina, but tibialis anterior on the superior by beneath the superior limb, superior oblique limb, it is enclosed within the superficial and the deep lamina, like this. Okay, now coming to the peroneal retinaculum. Peroneal retinaculum that lies on the lateral aspect. Okay, here on the lateral aspect, and it gave weight, it is also superior and the inferior peroneal retinaculum. Superior and inferior. So superior is like this and inferior is like this, making B. Okay, this is Y and this is B. This is superior peroneal retinaculum, and the medially it is attached to the lateral malleolus. This is medial malleolus and this is lateral malleolus. Okay, lateral malleolus. So peroneal retinaculum, superior peroneal retinaculum, medially attached to the lateral malleolus and laterally attached to the lateral surface of the calcaneum, and inferior peroneal retinaculum laterally attached to the lateral surface of the calcaneum, and medially it is continuous with the stem of extensor retinaculum. This is what? Extensor retinaculum. So inferior peroneal retinaculum is continuous with the stem of Y or a stem of extensor retinaculum, and it give way to the peroneus longus and peroneus brevis. Okay, peroneus longus and peroneus brevis. This is peroneus longus on the outer aspect, and this is peroneus brevis. Okay, so what next? Now knees joint and the quadriceps femoris. Suppose this is the patella and this is the quadriceps femoris, that is the rectus femoris, and on the lateral aspect this is vastus, on the medial aspect vastus medialis, on the lateral aspect vastus lateralis, and beneath the rectus femoris this vastus intermedius, and this is vastus medialis, and here it forms the medial patellar retinaculum. On vastus lateralis, on the lateral side form the lateral patellar retinaculum, and then it forms the ligamentum patelli and insert over the tibial tuberosity. So here it do not give passage to the tendon, it just put this quadriceps tendon in its place. It this retinaculum give fixity to the quadriceps tendon while passing through the knee joint. Here the purpose is different. Okay, so this is all about the retinaculum. Thank you.